Chapter 4 Source of Raw Milk Contamination on the Farm. Source of raw milk contamination on the farm. Learning outcome. After complete of this chapter, the learner will have a thorough understanding about the source of contamination of raw milk, have a critical knowledge about the mastitis in dairy animal and its public health significance. Source of contamination. The source of contamination of milk on the farm can broadly be categorized as interior of the udder, exterior of the udder. The interior reflects the health of the animal, while the exterior depends on the farm condition, equipment, personal water, etc. Interior of the udder. Interior of the udder. The animal by itself is one of the most significant contributors of microorganisms in milk. Microorganisms under the udder throat duct at the teat tip. The duct varies in length from 5 to 40 mm and its surface is heavily keratinized. This keratin layer retain milk residue and exhibit antimicrobial activity. During progress of milk, bacteria are present in the largest number at the beginning and gradually decrease. This is mainly due to mechanical disloading of bacteria, particularly in the teat canal, where the number are probably highest. Discarding the first few streams of milk result in lower count of microbes in milk. Milk from different quarters varies in number. Species of bacteria found in milk as it comes from under are very limited. Micrococci 30 to 99%, Streptococci 0 to 50%, Aspergillus gram-positive rod less than 10%, gram-negative rod less than 10%, Bacillus spore less than 10%, miscellaneous less than 10%. Micrococci are slow growing but if allowed to grow cause acid formation and proteolysis. They are mostly non-pathogenic. Streptococci less frequent. The micrococci agalacti may be present even non-clinical mastitis and thus it appears to be natural habitat of Lactococcus lactis species lactic is never been associated with other flora and occurs from external sources. Among gram-positive rod organisms of diphtheria, Corynebacterium bovis has been found in large number. It is non-pathogenic, but if grown cause rancidity, it has not been found from other sources such as fishes and milk products. Most of the bacteria are excreted in for milk. When the animal is suffering from some disease, the causative organisms are also likely to come into milk depending upon the severity of infection. The most common disease in milk animal is mastitis and the primary causative organism. Streptococcus agalacti is commonly present even though no clinical evidence of mastitis is present in the cow. The organism is normal inhabitant of the udder and is not pathogenic to man. The other common mastitis causing organism potentially harmful to human are Streptococcus aureus and Escherichia coli. Occasionally Streptococcus uberis, Streptococcus dysgalacti. Some of the other organisms encountered occasionally are Listeria species, Leptospira species, Bacillus cereus, Pasteurella maltosida, Clostridium perfringens, Actinomycetes, Coxiella brunetti, and the yeast Cryptococcus neoformans. The other organisms which can come through the animal include Mycobacterium tuberculosis, Brucella abortus, etc. Control. Animals should be maintained in clean, dry environment free from dust and dirt. Milk from the first stripping should be discarded. Milk from the infected udder should be discarded. Dairy animals should be periodically vaccinated, vaccinated against susceptible disease. Exterior for the udder. Exterior for the udder. Number and type of organism associated with udder vary depending on type of amount of soil. Udder and teeth become soiled with dung, mud, bedding materials such as sawdust, straw, etc. With heavily soiled udder teeth, the counts may be 1 lakh CFU per ml. Bedding material in winter has high number of bacteria. Main organisms in order of maximum number are psychotrophs, coliform, bacillus species. In summer, cow turn to pasture. The number of bacteria in bedding declines. Under microflora is not affected very much by washing. Sodium hypochlorite washing and accompanied by drying help in reducing in number. Teeth surface and animal body. Teeth surface and animal body. Teeth predominantly micrococci and coagulase negative staphylococci. Next predominantly fecal streptococci, but gram negative bacteria including coliform are less. Coliform do not surface well on teeth surface. Aerobic thermoduric organisms are entirely bacillus species. The more frequent are Bacillus licheniformis, Bacillus subtilis, Bacillus pumularis, and less frequent one are B. Cereus circulans. Greater number of bacteria get into milk from the surface of the cow body and from utensils that have not been washed thoroughly. Teat surface may also contain Clostridium spore that are usually found in cow fodder bedding and fishes. Prevention. Prevention. Prevent regular soil. Prevent regular soiling of teat surface. Wash with disinfectant. Drying of teat before milking. Chlorine. Presence of organic matter interfere and it is also irritant to hand. QAC satisfactory shop only detergent action in hard with recurring mastitis problems. Chlorine between 2000 to 400 ppm. 200 to 4 ppm. QAC 200 ppm were also not effective in preventing spread of mastitis. Cloth used for only one cow is separately and moistened in sanitizer after each use. Paper towel are preferable. Coat of cow. Coat of cow. Coats serve as vehicle to contribute bacteria directly to milk. Clipping of hair around udder, flanks and tail reduce the count of bacteria in milk. Coat may directly contribute organisms into air of the burn, especially Bacillus species. Coat may carry bacteria from stagnant water pools, especially ropey milk organisms. Coliforms may gain from soil and manure. Prevention. Periodic clipping of hair, regular brushing of coat, machine milking, milk burn and the environment. Milking burns and the environment. The housekeeping practice in the milk producing area also decided the level of contamination. The accumulation of mud, animal urine and feces, the left out straw and feed in the milking barn can directly or indirectly throw a milk can contaminated. Air is not important source of bacteria in milk. Air count in shade rarely exceed 2000 CFU per liter. Micrococci account for 50% aerial microflora. Other are aerobic spore former, corniforms, streptococci, and gram-negative role. Next important group is mold. Practices that increase aerial count through milk, sweeping or short time before milking, handling hay and feed just before milking, brushing animal just before milking, having dusty building material, allowing dust and dirt to accumulate on wall and ceiling. Prevention. The environment in the milking barn should be clean, The aerial contamination can be prevented by the use of small top milk pails and milking utensils. 3. Milking utensil. The improperly cleaned milk contained surface of milking equipment including bucket, pail, cans, bulk tank, etc. are the only source of contamination in milk after it leaves the udder. The most hazardous situation arises when the milking utensils are not thoroughly cleaned after use and the milk solid with some moisture are left on the surface. This, this allow growth of microorganisms and heavily inoculate the fresh milk which come in contact with these utensils. When mastitis is present in the heart, the utensil may contain Streptococcus, egg lacti, Staphylococcus aureus, E. coli, or Corynebacterium species. When hot cleaning of equipment is done, the predominating organisms are thermoduric, mainly Bacillus species and Micrococcus. When cold cleaning is followed, heterogeneous microflora are present. Control. Control. The milking utensil and equipment should be cleaned and sanitized before and after milking. The tank used for bulk transport of milk should be cleaned and sanitized immediately after the unloading of milk. Milker. When hand milking is done, the contribution from milker is high. Milker with infected wound on hand contribute pathogenic streptococcus and micrococcus. Activity like sneezing, coughing, etc. increase the risk of contamination. During the wet hand milking, lubricant enters milk and adds bacteria from hand and teeth. Pathogens causing typhoid, paratyphoid, dysentery, scarlet fever, septic sore throat, diphtheria, cholera, etc. are contributed from human. Action of milker may dislodge dust and dirt and increase air contamination. Control. The hand of the milker should be clean and he may dip his hand in antiseptic solution before milking. Unhealthy milkmen should be avoided. Bad habits like coughing and sneezing should be prevented within the milking barn. Water supply. Water supply. Water use should be potable and good in terms of bacteriological quality. Direct sources of contamination are storage tank not protect from rodent, bird, insect and dust. Houses, water through untreated water supplies from borewell, lakes and river may be contaminated at shore with fecal streptococci coliform, gram-negative rod, lactic acid bacteria, Bacillus species and Corynebacterium species. Chlorination. Chlorination. Chlorination with hypochlorite is recommended. Warm water use 37 degrees Celsius for under washing is potent source of Pseudomonas and coliform. Control. Control. Water used for cleaning should be free from fecal contamination and water may be chlorinated before use. Milk machine. Milking machine are used when large number of animals are to be milked at a time. As milk production in India is mainly through marginal farmer in very small scale, the milking machine is rarely used. However, when they are used, proper care is required not only in its cleaning but also in its use because its improper use may damage the udder and thereby increase risk of contamination. In a survey, about 20% of milking machine cluster had should rise count of 1 into 10 power 6 CFU cluster. This showed that is significant as a source of contamination when pipelines are rescued from direct milk collection. Their improper cleaning and Sanitation add further to the microbial load of milk. The type of microorganisms coming from milking machine are similar to those coming from other equipment. Control milking machine should be cleaned and sanitized using iodine sanitizer as a routine practice. Storage and transport. Storage and transport. Mainly the psychotropic and thermoduric bacteria contaminated the milk through unleashed milk can and bulk milk transporter tanker. Among the psychotropic genera in stored milk, Pseudomonas species, mainly fluorescence generally predominant. Moreover, the type of contamination contaminating microflora depend on the temperature of storage as follow: 0 to 5% Pseudomonas fluorescens, 5 to 10% Pseudomonas species Proteus vulgaris, Micrococcus species Alkaligens, Viscolactis Marshalli, 10 to 50% S. galacti, Lactococcus lactis, subspecies Cremoris, S. durans, Dysgalacti, Facilis, Lactococcus lactis, subspecies Lactis uberis, 50 to 30 degrees Celsius are Streptococci, especially Lactobacillus lactis, species Lactis, 30 to 40 degrees Celsius, Enterobacter aerogenes, E. coli, and lactic acid bacteria, Lactobacillus brevis, L. vulgaricus, L. casei, L. formenti, Helveticus, lactis, plantarum, and a few streptococci. 40 to 50 degrees Celsius, lactic acid forming rod, Bulgaricus formenti, Helveticus, lactis, plantarum, L. colcanicus, Thermophilus, and thermophilic streptococci like Fasciculus and Thermophilus. Control. Milk should be stored and transported between the temperature of 0 to 5 degrees Celsius. Mastitis. Mastitis. Mastitis, inflammation of udder. Mastitis milk is the milk obtained from animals suffering from the udder disease called mastitis. The mastitis milk has higher microbial count and stomatic cell count and has altered composition accompanied by reduced yield. Most common symptoms are those related to inflammation, swollen, hot, red, and painful udder. Mastitis can be classified based either on symptoms or on causative microorganisms. Based on symptoms, acute or clinical, the form in which microscopic change in the milk or the udder is readily detectable by the milker. Subacute or subclinical, the more commonly occurring form in which both the milk and the udder appear normal and can be diagnosed by examination for milk sample for various compositional changes and presence of pathogenic bacteria and somatic cell. Cloning, this form of mastitis involves like compositional change in milk and almost complete absence of pain in the udder. Vaccidon causative microorganisms, contagious mastitis, Escherichia, common mastitis, Streptococcus, Staphylococcus E. coli, summer mastitis, Corynebacterium pyogenes occurs in summer month in heifers and unmilked cow. Mastitis cause microorganisms. Mastitis is caused as a result of udder infection with one or more of the causative organisms. These microorganisms enter through the teeth tip into the teeth duct where they get colonized due to the presence of leftover milk in the duct and subsequent spread throughout the udder causing infection. The type of microorganisms associated with mastitis, most common causative are Staphylococcus aureus and Staphylococcus agalactiae, coliform E. coli, Enterobacter, Klebsiella, Citrobacter, other streptococci. Ubericus dyslexia as basically as pyogens. Other Staphylococcus staphylos, epidermis, and Staphylococcus albus. Corynebacteria, Corynebacteria bovis, pyogens, ulcerans. Mycoplasma group, Mycoplasma eagletia bovis, Rickettsia, Coxiella brunetti, yeast, Cryptococcus neoformans, Candida pseudotropicalis, mold, Aspergillus species, number of ammo excreted through milk, streptococcal and coliform mastitis high, Staphylococcus mastitis low. Somatic cell in mastitic cells. Somatic cell in mastitic milk. The animal body cell called somatic cell are normally present in milk and their number increase steadily in mastitis milk. There are two types of somatic cell associated with milk. Epithelial cell derived from the outer surface of the secreting tissue of the udder. Leukocyte or white blood cell derived from blood and are abundant than epithelial cell. The somatic cell count of normal milk varied from 400 to 1 million per ml. In abnormal milk, it may be up to 368 million per ml. As per the American Public Health Association, somatic cell count should not be more than 5 into 10 to the power 5 somatic cell per ml of normal milk. Compositional changes in mastitis milk. Compositional changes in mastitis milk. The colonization of mammary gland by mastitis causing microorganisms triggers a series of events which in turn cause major compositional alteration. Initial elevated level of pathogenic bacteria occurs, which is closely followed by marked increase in somatic cell count. Subsequently, there occurs a wide range of related effects like the impaired synthetic ability of the secretory tissue, causing lower milk yield and altered level of major and minor milk constituent, and increased infiltration of blood constituent like serum protein into milk. In general, the milk from infected quarters in different form of mastitis may have the following altered constituent with increased concentration. The level of total wavy protein, mainly bovine serum albumin, immunoglobulin, sodium chloride, and other iron like CUFE, ZN, various enzymes, and certain glycoprotein increases significantly. The pH of milk also increase. Constituent with decreased concentration, the level of lactose, fat, total casein, alpha and beta globulin, potassium, and other minerals like calcium, magnesium, and phosphorus decrease. On the whole, the mastitis milk generally has a lower SNF, fat, casein, and lactose, and higher serum protein, chloride, iron, and pH. Milk contains normal milk, mastitis milk, fat, protein, lactose, bovine serum albumin ml per ml, lactoferrin ml mg per ml, sodium, potassium, chloride, pH, somatic cell, catalase, lactic dehydrogenase, alkaline phosphate, acid phosphate, lysozyme. Significance of mastitis milk. Significance of mastitis milk. Significance of mastitis milk. Mastitis in the lactating animal affect the yield, quality, and public health aspect of milk. Milk yield, the net milk yield, and also the productive life of the milch animal are adversely affected due to mastitis. Milk quality. The quality of milk is lower due to compositional changes. Suitability for fermented dairy products. Mastitic milk is not suitable for making fermented milk product. In cheese making, the following adverse effects are noticeable in the product on using mastitis milk. Lower yield. This is due to increased fat losses in the baby and reduced starter activity. Poor quality. Renate clothing time is increased, causing decreased card firmness and a loose final texture of cheese. Lack of adequate flavor development due to retarded starter activity. Other fermented product. Mastitis milk is not suitable for preparing fermented milk like dahi, yogurt, cultured buttermilk, kefir, etc., in which the product quality is directly dependent on the performance of starter culture. The starter bacteria are affected in terms of their growth and activity, acid and flavor production. Starter growth is considerably slow in subclinical mastitis milk. For instance, both lactobacilli and lactic staphylococci are inhibited in milk from streptococcal and staphylococcal cases of clinical mastitis. Both the rate of acid production and the final acidity attained in mastitic milk are lower than that in normal milk. Even at less than 5% level of mastitic milk in the pooled milk, the aroma, taste, and consistency of the end product are adversely affected. Diacetyl production by Streptococcus diacetyl lactis is lower in mastitis milk. Public health significance. Public health significance. Some of the mastitis causing microorganisms which are excreted in milk are also pathogenic to human beings. For example, certain strains of Staphylococci associated with mastitis milk cause food poisoning in humans due to enterotoxin production. The storage of mastitis milk under favorable temperature lead to elaboration of enterotoxin which are not inactivated even during pasteurization and spray drying of milk. Other pathogen and food poisoning bacteria like Salmonella species and enteropathogenic strain of certain coliform, E. coli and Klebsiella might also be associated with public health hazard through mastitis milk. Detection of mastitis milk based on compositional changes. Detection of mastitis milk based on compositional changes. Detection of mastitis milk based on compositional changes. pH of milk. ये चौथा detection of mastitis milk based on the causative microorganisms. Detection of mastitis milk based on the causative microorganism. Microscopic examination. This is helpful even in detecting the admixture of mastitic milk with hard milk. Presence of long chain of streptococci is indicative of mastitis due to aglecty, whereas occurrence of cell in grape-like bunch in milk suggests staphylococcal mastitis. Host test. Host test. Host test. This test is meant for differentiating Staphylococcus aureus from Aglectia. Her 9 ml of milk should be mixed with 0.5 ml or 0.5% bromcresol purple solution and incubated at 37 degrees Celsius for 24 to 72 hours in a culture tube. The appearance of canary yellow color colony along the wall and at the bottom of the tube is diagnostic of Aglecta mastitis, whereas Staphylococcus aureus give rusty brown color of the colony on the wall of the tube. Blood agar test. Blood agar test. Pre-incubating 37 degrees Celsius overnight. Mastitis milk sample should be streaked on blood agar. The different causative of mastitis can be detected based on the following observation. Observation: organism. Small colony alpha or beta hemolysis with occurs or no hemolysis will occur in some cases. Eclectia, alpha hemolysis, dyseclectia, no reaction, uberis, large colony then streptococci, beta hemolysis, oresus. Camp test. Camp test, Crystal Atkin Munch. Crystal Atkin Munch Pearson test. This test is made especially to confirm Staphylococcus from mastitis milk. A standard culture of Staphylococcus aureus should be extracted vertically down across the center of a blood agar plate. The suspected streptococci isolated from mastitis milk should now cross extract horizontally at an angle, taking care that these stragi do not come into contact with Staphylococcus aureus stragi. After incubation at 37 degrees Celsius overnight, Streptococcus eclectia will produce a clear zone between its streak and that of Staphylococcus aureus. Thank you.